Hello and welcome. Let's talk about hemorrhoids. So, what does it mean by hemorrhoids? The dilatation, elongation, and tortuosity of the anorectal venous plexus formed by radicals of superior, middle, and inferior rectal veins. This is known as hemorrhoid. The common sites or positions are 3 o'clock, 7 o'clock, and 11 o'clock positions. Classification. One classification is external hemorrhoid, internal hemorrhoid, and internal-external hemorrhoid. Second is primary hemorrhoid and secondary hemorrhoid. And the third one is first degree, second degree, third degree, and fourth degree. For first degree, there is only bleeding with no any prolapse. In second degree, there is prolapse, but it reduces spontaneously. And in third degree, there is prolapse, but it should be manually reduced. And in case of the fourth degree, it is permanently prolapsed, which never goes inside. Now, internal hemorrhoids, these are the symptomatic anal cushions and characteristically lie in the third, 7th and 11th o'clock positions with the patient in the lithotomy position. External hemorrhoids, these relate to the venous channels of the inferior hemorrhoidal plexus deep in the skin surrounding the anal warts, and these are not true hemorrhoids. Internal-external piles, these are the external hemorrhoids associated with internal hemorrhoids known as internal-external piles, which results from progression of the latter to involve both hemorrhoidical plexus and are the best thought of being external extension of the internal hemorrhoids. Now, causes of primary hemorrhoids. It may be hereditary, morphological, anatomical, portal hypotension and varicose vein, hyperplasia of the corpus cavernosum recti, infection, constipation, anal hypotonia, aging, and other factors like pregnancy and straining micturition. Causes of secondary hemorrhoids. It may be due to carcinoma of the anorectum, local causes like anorectal deformity and hypotonic anal sphincter. Pelvic cause may be gravid uterus and uterine neoplasm, and neurological cause includes paraplegia. Now, clinical features. There is bright red painless bleeding, there is mucus discharge, there is prolapse, and there is pain only on prolapse. Examination of the internal hemorrhoid is done with DRE and proctoscopy. Now, treatment options of hemorrhoid. Symptomatic. This advice can be given about dietary habits, stress softeners, and bulking agents. Injection of sclerosant can be given, banding, and hemorrhoidopexy with hemorrhoidectomy can be given. Now, management of first degree hemorrhoid. Symptomatic treatment includes fiber-containing diet to prevent constipation, soft stool softeners, and bulking agents. Bowels are regulated by hydrophilic colloids, and suppositories, proprietary creams, steroid ointment can be given. Active treatment includes injection of sclerosant therapy. If treatment is failed, then hemorrhoidectomy can be done. Second degree hemorrhoid. The symptoms are bright red painless bleeding, mucus discharge, prolapse, and pain only on prolapse. The signs are on inspection. Hypertrophied skin fold at anal margin may be seen. When the patient strains, second degree internal hemorrhoids come into view, and may be present if profuse bleeding occurs from hemorrhoids. On direct rectal examination, internal hemorrhoids cannot be filled unless they are thrombosed. Investigations include proctoscopy and sigmoidoscopy. Treatment of second degree hemorrhoids. Symptomatic includes treatment of constipation and minimal invasive procedure like banding treatment with rubber band ligation, injection of sclerosant, and cryosurgery or extreme cold surgery can be done. Surgery includes hemorrhoidectomy and lung operation. Third degree hemorrhoid. Clinical features are patient may feel a large mass coming down through the anal canal which cannot be reduced, severe constant unremitting pain, mucus discharge, pruritus following discharge, per-rectal bleeding during defecation. Signs. A large hemorrhoid protruding from the anal orifice is seen. The pile shows groans, edema, and lateral ulceration. Edema on anal margin may be seen. Tenderness is present. On DRE, the thrombosed part can be filled with fingers. Treatment. Symptomatic treatment like bed rest, analgesics, frequent hearty bath, warm saline compression, appropriate antibiotics, and steroid can be done. Surgery includes ligation and excision of the pile, hemorrhoidectomy if necessary, and lung operation. External hemorrhoid. The causes are as a part of internal piles, sentinel pile associated with anal fissure, and anal stent tags. Treatment is the cause is treated, sitz bath may be given, and excision can be done. End of the topic.